Hi, this is Robert Carlson with Brave Defender Training Group. I want to take a few moments and I want to discuss a critically important part of the tactical emergency casualty care or tactical medical program for law enforcement officers, and that is dealing with patient movements or casualty movements. There's a variety of circumstances where law enforcement officers may find themselves needing to execute a movement on a wounded individual. This could be a fellow officer that's been wounded or a citizen. Both times we're going to need to be able to make this happen in the safest, most efficient, and most tactical manner possible. Now, this could be something as quick as a short, rapid, explosive movement, such as trying to get a wounded individual off of the point of injury, or what we call the X, to a position of cover or concealment so that we're better able to start rendering aid. Or once we've rendered that aid, this may be more of a long distance complex movement to get that casualty to a ambulance or transport vehicle in order to try and get them to a hospital or higher level of care. Both of these situations are different and unique and are going to require different considerations for us to look at. Now, one of the first things that we want to do when we're talking about casualty movement is we want to make sure that we develop a good solid plan on how we're going to execute this. I don't want to just run out into the open and just start grabbing the casualty with no careful thought of how we're going to do this, because our goal in this is to make this happen in the safest, most efficient manner without causing additional injuries to the casualty. So that means we need to put a little bit of thought into this. Now, preferably, I'm going to develop this action plan from some sort of cover or concealment myself. Before I potentially expose myself to a hostile threat, I want to have a plan of how I'm going to execute this movement. So from behind our last position of cover, if we're able to do so, what I want to do is I need to conduct what we call a patient assessment. I need to look at the casualty and determine what's the severity of their injuries. Is the casualty able to assist in their own rescue? Are their injuries relatively minor? In which case, if they're able to move themselves, there's no need for me to go out and conduct the casualty movement. It's probably going to be preferable in that situation for me to direct the casualty to move to me while I provide security and cover for that individual. That way we're minimizing our exposure to the threat and maximizing the amount of guns that we're able to use to provide security. Now, conversely, the exact opposite of that, potentially this casualty's injuries are so extreme that they're already deceased by the time we get there, or upon visually assessing the casualty, we determine that there's just absolutely nothing in our power that we can do to assist them. In that scenario, it's probably not best at that time period to go out and try and execute a movement on a casualty when we can't actually render any aid to them. So we don't want to expose ourselves to potential incoming fire when there's nothing we can do once we reach the casualty anyways. But what we're going to focus on is that middle ground, where we have a casualty that's unable to move under their own power, but their injuries are survivable. So we're going to need to actually go out and execute an assistance or a movement on that casualty. Now, as part of this plan, before I break that cover, it's really important that we take a look at the scenario and we decide, where are we going to take this casualty to? Where's the closest or best point for us to move this casualty to where we're able to get behind cover and render aid? And then come up with a plan of action. How are we going to actually execute this movement once we reach the casualty? This way we're not sitting out in the open trying to make all of these decisions, and we've developed this plan where it's safe for us to be able to do so. Now, there's a variety of different techniques that are out there and that are taught to be able to conduct casualty movements. And there's no single best technique. Each technique is good for certain scenarios and certain situations. So you're going to need to determine what the best one is for you based upon different considerations. Our ultimate goal in however we try and do this is we want to try and minimize any additional injuries to the casualty. So when we're making that decision of how we're going to actually execute this movement, there's different considerations that we need to take into account. The biggest one is going to be, what's the distance that we need to move? Is this that short explosive movement where I'm just trying to get this casualty to a close point of cover to render aid? Or am I going to have to move this casualty an extended distance to get to a waiting transport vehicle? Those are going to require different movement techniques. And that longer distance is going to limit my options that I have available versus the shorter distance. However, in that one, time is more of the essence. Another important factor to consider is how many rescuers do I have available to me? Is this a situation where I'm having to do this myself, in which case this is going to be a single officer rescue where I'm also having to worry about my own security? Or am I part of a team where I have officers that can provide security while I have multiple officers that can assist me in the movement of the casualty? That's going to drastically increase my options for how I'm going to move this casualty, as well as increase my safety. Another important factor to take into account is what is the size of the patient versus the size of the rescuer. Well, if we're talking about a very large casualty and we have a very small framed rescuer, that's going to drastically limit the options that they have in order to move that casualty. Versus the opposite, where we have a very small casualty and a very large or very strong rescuer, they're going to have a lot more options that are available to them. So we need to look at what is our actual capabilities with the size of the casualty that we're trying to move. We also have to take the threat into account. During this movement, are we going to need to be able to have continued access to our weapon in order to be able to provide our own security, or is the threat still active? That's going to drastically impact how I move this casualty. I also have to factor in what resources I have available to me. Do I have objects that I can use to assist this movement, such as a commercial litter? Now, in most of the scenarios that law enforcement are going to encounter, especially in a uniform patrol situation, we're not going to have access to any kind of commercial pre-made litter. However, it's very easy based upon the environment that we're in, where we can use objects that are around us to make improvised litters or improvised devices that we can use to help us do this movement. So things such as chairs, desks, tables, doors, pieces of wood, these are all things that I can use to help me make this movement faster and more efficient and easier on myself. Now that I've weighed all of those different considerations, I need to choose the movement technique that's going to be best for me, best for my casualty within the scenario that I'm facing. And as I said before, there are literally dozens and dozens of different movement techniques that are taught around the world. However, what we want to do is we want to try and keep it very simple. We don't want to get super complicated where under stress we're trying to remember a lot of different things. So I want to use movement techniques that are very simple and very adaptable based upon the scenario. Instead of having to memorize multiple techniques, I can use one or two to fit a variety of situations. And these are ones that I can use whether I'm a single officer, and then as I get additional resources on scene, I can adapt them with multiple individuals to go from a single officer movement to a multiple officer longer distance carry. So as we said, we want our movement techniques to be simple and versatile, that we can move whether we're having a single officer or multiple officers. We just want to keep it as simple as possible. So one of the simplest and easiest ways to rapidly move a casualty off of the X, or the point of injury, to a piece of close cover is going to be a single officer drag. There's a variety of techniques that are out there, but probably the easiest and simplest one to do is what we call an under the arm drag. So in order to do this correctly, what I'm going to do is I'm going to approach my casualty from the head. As I approach my casualty, I'm going to drop down, grabbing a hold of his shoulders, rising him up to a seated position. I can then brace his weight against my hip or my leg. I'm going to take my arms and slide them up underneath his armpits and secure his wrists, bringing them close against his body. I can now assume a squatting position, and then lifting with my legs, I can rise up to a standing position and then quickly drag my casualty to a point of cover. Now, the advantage of this technique is it's easily adaptable as I get more resources on scene. So as I get more officers, I can take this same technique and change it from a single person drag to a 2-officer carry. So now my partner arrives on scene. He's going to approach the casualty's feet. He's going to kneel down at the feet. I'm going to take my same actions up at the head, rising the casualty up, coming up onto the armpit and securing the arms. What my partner is going to do while I'm doing that is he's going to cross the casualty's ankles over the top of each other. What this does is, especially if we have an injured lower extremity, it allows us to place that extremity on top of the good one and use that for support.
Now my partner's going to stand with the casualty on his support side, so that way he can access his weapon if need be while we're moving. And then on the command of 3 of the person at the head, we're going to lift up. So up on 3, 1, 2, 3. So now from here, we're in a good 2-person carry technique where we can move this casualty an extended distance to a waiting ambulance or transport vehicle if we need to. All right, forward. And down on 3, 1, 2, 3. So using this movement technique, we can adapt it for a variety of situations. Now, what if our casualty is semi-conscious and able to move under their own power? In that kind of situation, I don't want to just send him off on his own, because if he loses consciousness, I may not be aware of it and he may fall and aggravate that injury more. So I'm going to do what's called an escort technique. So with an escort technique, all I'm going to do is on the casualty's injured side, simply come up, take his arm and place it over the top of my shoulder. I can then take my arm, reach back behind, secure either his belt or his pants, and hold on to it, and we can now move out. And that way, if he loses consciousness, I'm able to support him and help guide him down to the ground if need be.
One final consideration. Anytime once we've completed a casualty movement, I want to make sure that I reassess any medical interventions or treatments that I did before, specifically tourniquets. So once I've completed this movement, I want to go back and I want to reassess any tourniquets that I may have placed on this individual to make sure that they didn't come loose or shift during that movement, as oftentimes happens. I want to thank everybody for taking the time to watch this video, and hopefully you found something in it useful that can better aid you in doing your duties and keeping your community and your partner safe. Nothing we said in this video replaces actually going to and receiving good hands-on training. So I encourage all law enforcement officers to get out there and receive good hands-on tactical medical training to better aid them in being able to do their duties. If there is anything that we can do to assist you in performing your job and keeping you safe, please do not hesitate to contact us or reach out to us. Thank you very much and be safe.